Dear doctors, welcome to Longevity Code webinar. And we will talk today about longevity hormones, the biochemistry of internal youth. My name is Ecaterina Lica. I am the founder of Lica.Doctor Academy and co-creator of Longevity Code course, a medical education project dedicated to the medicine of the future. I am board certified dermatologist, a regenerative medicine expert, and also Diplomate of American Academy of Regenerative Medicine. And together with my dear colleague, Dr. Alla, who is a scientific director of Longevity Code course, we created Longevity Code Academy, a course about longevity medicine. And Dr. Alla is a functional medicine physician with over 15 years of clinical experience, specializing in hormonal optimization, longevity medicine, and also regenerative therapies. She is a diplomate of American Academy of Regenerative Medicine. She is certified by Functional Medicine University from USA. She is also a recognized speaker, a functional and longevity medicine in functional longevity medicine, also an author of medical books on peptide therapy, hormonal therapy, metabolic health, also expert in application of peptides, hormonal protocols, and longevity strategies. And Dr. Alla actively practices longevity medicine in the first longevity clinic that was opened in Dubai, and combines with, in her experience, and peptide therapy, stem cells-based approaches, exosomes, and also advanced regenerative and anti-aging treatments. Please visit Dr. Alla's page on Instagram, and you will learn a lot about longevity medicine and about her vision in longevity. And so here we are happy to see you here, because we will talk today about longevity hormones and biochemistry of internal youth. And but why we talk about it? Because the medicine of the future begins today, and the medical paradigm is changing, and the medicine of the future is not about reacting to disease. It's about preventing aging, preserving function, and restoring balance. And longevity medicine integrates functional medicine, regenerative medicine, hormonal optimization, and also cellular and mitochondrial health. So that's why we created the course, which is consists of 12 modules, medical program that is designed for doctors who are ready to master the future of medicine. And the course blends cellular aging, peptide therapy, hormone optimization, regenerative medicine, and each module provides a strong theoretical foundation, evidence-based clinical protocols, and also practical integration into daily medical practice. And this course is for the doctors of any specialty who understand that patients today are seeking quality of life, prevention, and not only treatment, youthfulness and vitality, energy, clarity, and longevity. And the future belongs to those doctors who master preventive strategies, regenerative technologies, and functional and evidence-based medicine. And our longevity code course is unique because we have different structured modules, step-by-step clinical logic, ready-to-use protocols, real clinical cases, and very practical tools for each doctor. And our approach is logical, scientific, highly practical, and that's why it's very popular among the doctors all over the world. Here you can see the complete structure. So we have different modules. One of the module is hormonal health, and this webinar we will talk about the hormones that enter in the hormones modules, but we talk also about the gut health, the IV and nutrition therapy, ozone therapy, biohacking, functional medicine, sports medicine, mental health. So you can see everything on our landing page. And if we talk about hormones module, this hormones module includes not only longevity hormones lecture, but also growth hormone, thyroid hormones, male's health, women's health, and also cortisol. Of course, we cannot be without it. And today we will talk, and Dr. Alla, we will talk especially about longevity growth hormones. We will focus on it. Now you will listen a very interesting practical lecture, but please, during this lecture, don't hesitate to ask us the questions. At the end of the lecture, we will answer all the questions to you, and then I will tell you more about our hormones module. So Dr. Alla, please, now is your turn. I stop to share my screen.
Welcome, everyone. I'm really glad to have you here today, and thank you for taking the time to join this session. Over the past decade, longevity medicine has become one of the most promising and widely discussed fields in modern healthcare. And this is not surprising. We are gradually moving away from a purely disease-oriented model toward a patient-centered approach. And at the same time, the focus is shifting, not just toward extending lifespan, but toward improving quality of the life. And today, the main request we hear from the patient is very clear. They want to maximize their active, productive, and independent years. And today, we'll be talking about the longevity hormones. And I'd like to start with a very simple but important question. Why hormones? So hormones are the body's internal messengers, and they regulate how every cell functions, repairs itself, responds to stress, and maintains balance. And in many ways, hormones sit at the core of almost every biological process in the body. And as we age, hormonal levels naturally change and often decline. And this shift is one of the key drivers behind many of the age-related conditions we see in clinical practice today.
Dr. Alla, sorry, we don't see your screen.
Oh, just a second, I'm sorry. I will stop sharing and restart again. What about now?
Now I think it's loading.
Okay, great. So, before we go any further, I want to highlight one fundamental idea. Longevity isn't just about extending lifespan. It's about extending health span. It's about maintaining energy, mental clarity, emotional stability, productivity, and resilience at any age. So in other words, it's not only about living longer, but about living well. And modern longevity medicine is moving away from simply treating disease and toward preserving function, physical, cognitive, and metabolic. And our goal isn't just to help someone reach 80, 90, or even 120 years of age. Our goal is to make sure those years remain active, meaningful, and enjoyable. And one of the most powerful systems shaping how we age, how we feel, how we perform, and how we recover is the endocrine system. That is why understanding longevity hormones is absolutely essential for any clinician working with aging patients. And today we will explore the key hormone pathways that influence vitality, cognition, metabolic stability, and overall biological resilience. Today we will discuss the role of the hormones in our longevity, in our aging, and how we're able to manage them, fix them, and also share practical, clinically relevant insight that you can immediately integrate into your work with the patient. So let's begin. When we talk about longevity, most people immediately think about nutrition, exercise, detox program, or even the microbiome. And they're right. Of course, all of these matter, and you already know that. But I'd like to ask you a question. What actually coordinates all of these systems? I will give you like just few seconds to send an answer in our chat, and then I will continue. So behind nutrition, behind physical activity, behind detoxification pathways, there is something even more fundamental, our hormones. Hormones are the body's internal signals. They determine how fast we age, how well we recover, how we respond to stress, and even how stable we will feel emotionally. And when these signals are balanced, the entire system works much efficiently. And hormones, they influence metabolism, immune function, tissue repair, brain performance, essentially every process that keeps us healthy, energetic, and resilient. And here's basically the key point I want you to remember. Hormones don't just affect how long we live, they determine the quality of our life. So someone can live to 90, but if there is no energy, no sleep, no mental clarity, no joy, that's not real longevity. So if our goal is to help people live not only longer, but better, we need to understand how longevity hormones work and how to keep them in balance over the time. And to do that, we first needed to look at which hormonal system are most critical in the aging process. And today, when we talk about again longevity, most discussion and most research begin with the microbiome. And what makes perfect sense, the state of our gut flora affects immunity, inflammation, metabolic reaction, and even neurotransmitters production. And in many ways, it's a true foundation for health. But if the microbiome is the foundation, what shapes the building on top of it? That's right, it's the hormones. And hormones are the architects. They determine how the entire system is built, how we look, how fast we recover, how much energy we have in the morning, how our brain performs, and how our skin ages. So I often say, if you want to live long, support your microbiome. But if you want to live beautifully, balance your hormones. Because here's the reality. Without proper hormonal balance, it is almost impossible to preserve youthfulness. Even if your nutrition, gut, supplements, stress management, and lifestyle are perfect. And that's exactly where we are going to focus on today. The key hormones that define longevity and how we can work with them clinically to help our patient not just live longer, but live better. And when we talk about the youth hormones, most people immediately think of growth hormones or classic sex hormones like estrogen, testosterone, progesterone. I'm right, yes? So these hormones are closely connected to how we look, how much energy we have, how our libido, muscle mass, and bone strength. And they are the ones we usually associated with the feeling young. But the story of hormonal influence on aging goes far beyond these familiar players. The endocrine system is not a collection of separate pieces. It works as a network where each hormone affects and is affected by the others. So you can imagine is it an orchestra? Every section, every instrument contributes to the harmony. If one section fell out of balance, the music changed, subtle or sometimes dramatically. And longevity and the youthfulness are not about increasing one hormone in isolation. They come from the balance and coordination of multiple hormonal systems, sex hormones, stress hormones, metabolic hormones, regenerative hormones. Each of them plays a role, and the way they interact determines how our bodies age, how we recover, how our metabolism function, and even how we feel mentally and emotionally. And understanding this network approach is essential. It shows that aging is not simply about one hormone decline, but about how the entire system adapts, compensates, and falls out of the rhythm over time. And this perspective guides everything we do when we work with a patient to preserve both longevity and quality of life. Nevertheless, when we talk about anti-aging, we cannot overlook growth hormone. It's one of the most well-known longevity hormones. Its production peaks during childhood and adolescence and then gradually declines after the age of 30, not 35, not even 40. Very early, at 30, we will already see the first changes. But it would be a mistake to think that growth hormones is only important for children. This decline often coincides with the changes many adults notice. I mean, slow recovery after exercise, problem to gain muscle mass, less muscle tone, less motivation, softer skin, sagging of the skin, and shift in the fat distribution. Growth hormone works mainly through stimulating IGF-1, and together they support tissue repair, collagen production, fat breakdown, muscle growth, and integrity of connective tissue. But growth hormone is not just a building hormone, it's fundamentally a restoration hormone. Its influence extends far beyond the physical. So growth hormone support immune function, regulates glucose and lipid metabolism, aids bone mineralization, and even promotes neurogenesis. It protects our neurons from oxidative stress and contributes to cardiovascular health by maintaining endothelial function. It also influences our emotional well-being. Vitality, motivation, and overall drive are very close linked to healthy growth hormone levels. And growth hormones is intimately tied to nighttime repair. Its natural release depends on deep sleep, stable blood sugar, and a healthy circadian rhythm. So when someone steps poorly, eats late at night, or lives under chronic stress, no supplements or stimulant can fully restore growth hormone function. And the symptoms of low growth hormone are often recognizable. Morning fatigue, so your patient can tell you that, okay, I sleep whole night, but in the morning, I already exhausted. Loss of muscle mass, your patient can live in the gym, training 5 times per week, but still no results, no muscle gain. And of course, increasing visceral fat, the stubborn abdominal fat, thin skin, sagging of the skin, sagging in the shoulder, and reduced bone density, slower healing, apathy, anxiety, and even cognitive decline. And recognizing these patterns help us understand why growth hormone is so central to longevity. And it is also reminds us that lifestyle, sleep, and stress management are inseparably from any intervention aimed at maintaining youthfulness. And again, in longevity medicine, our goal is not simply to push growth hormone level higher. What we aim at is for rebuild the body's natural physiological secretion. We achieve this primarily through lifestyle and behavioral strategies. I mean, improving sleep, especially during the first half of the night, is essential. Intermittent fasting, regular strength training, stabilizing glucose and insulin, and effective stress management. So all play a crucial, critical role in supporting healthy growth hormone release. In addition to these lifestyle measures, we can use peptides, such as a growth hormone releasing hormone and growth hormone releasing peptides. These compounds are designed to support growth hormone release and maintain natural peaks in the body. And compared with a direct growth hormone therapy, peptides are generally safer, more predictable, and have fewer side effects. Currently, examples include like a growth hormone releasing hormone peptides like a CGC, tesamorelin, and growth hormone releasing peptides such as ipamorelin. We will go into more detail on these compounds in our peptide model, where protocols and indication will be reviewed. But overall, these peptides help stimulate the body's own growth hormone production without overriding its natural rhythm. And actually, growth hormone replacement therapy is reserved for patients with a clearly diagnosed, clinically significant growth hormone deficiency confirmed by lab testing. And when dosing is not carefully controlled, risk including insulin resistance, carpal tunnel syndrome, tissue overgrowth, cancer can become significant. So the focus is always on restoring healthy natural growth hormone physiology rather than for forcing supraphysiological levels. And this approach aligns with the broader goals of longevity medicine, improving function, resilience, and quality of life in a safe, sustainable way. Another hormone that we cannot do without in our longevity protocol, and which is equally important in both men and women, is a testosterone. Yes, it's not only male hormones, women also need it. And when we hear the word testosterone, most people immediately think of strength, muscle, and libido. But testosterone is much more than a male hormone. It is one of the co-regulators of a metabolic, vascular, and neurological health. And testosterone is able to stimulate erythropoiesis, improving oxygen delivery to tissue. It enhances insulin sensitivity, lowering the risk of the metabolic syndrome. It supports protein synthesis, muscle strength, bone density. It also improves endothelial function, helping body vessels dilatate and increase nitric oxide levels. So on the top of that, testosterone protects the brain by increasing dopamine and serotonin, reducing inflammation and lowering the risk of cognitive decline. In men, low testosterone is not about reduced libido or fatigue. It is strongly associated with a higher risk of diabetes, cardiovascular disease, and depression. In women, even small amount of testosterone are crucial. It influences motivation, concentration, energy level, and bone density. And the symptoms of low testosterone are often characteristic: chronic fatigue, loss of drive, reduced motivation, memory problem, decreased muscle mass, and increased fat, disrupted mood, and poor sleep. So testosterone doesn't act in isolation. It is very close connected with cortisol, insulin, dehydroepiandrosterone, and chronic stress, inflammation, poor sleep can also suppress testosterone production regardless of the age. Now in the clinic, we see a lot of patients, 30, 35 years old, who already have a testosterone deficiency because of their lifestyle, and this is horrible. And in longevity medicine, we don't start with a testosterone therapy directly. We focus first on restoring overall hormonal balance, optimizing lifestyle, improving nutrient status, reducing inflammation, managing stress, and stabilizing glucose. And only when the true deficiency is confirmed, both clinically and through the lab test, do we consider bioidentical testosterone, and always under very careful monitoring, because precision is essential. And testosterone is not just the hormone of strength and libido again, it is the hormone of the life force. I mean, vitality, confidence, and cognitive resilience. So again, when we work with the testosterone in longevity framework, one of the first thing I always emphasize is a single total testosterone value never tell the full story. Testosterone doesn't exist in isolation. It functions within a very dynamic hormonal network. And if we want to understand what is really happening, we always need to look deeper. Of course, we measure total testosterone, but we also assess free testosterone, because this is the fraction that actually interacts with the receptors and produce biological effects. We evaluate SHBG, sex hormone binding globulin, because it can completely change the clinical picture. It's able to link with active testosterone, decrease its potency. A patient can have a normal total testosterone level and still experience clear symptoms if SHBG is elevated. We then look at DHEA, one of the key precursors for testosterone, and DHT, dehydrotestosterone, which reflect how actively testosterone is being converted. And of course, we don't supposed to forget about estradiol, because part of the testosterone naturally aromatizes. And if the patient has excess estrogen, it's no matter how low his testosterone, we will never prescribe for him testosterone, because in this case, we will trigger higher aromatization, more level of the estrogen, and it can cause significant consequences. I mean, not only inflammation or gynecomastia, abdominal fat, but it also able to stimulate and increase the viscosity of the blood and cause thrombosis. And this is a slightly dangerous condition. And only with a complete this panel, we can understand where the problem truly lies. It is impaired production, altered conversion, excessive binding, or chronic stress that suppress the entire axis. And when it comes to correction, there is no single universal strategy for every single patient. The approach depends entirely on why the deficiency dependent and developed. And in cases of true hypogonadism, testosterone replacement therapy becomes the most reliable option. And in clinical practice, we often use liposomal gel for stable physiological absorption. And also we have injectable forms when stronger or longer lasting levels are needed, short-acting forms, long-acting preparation, or mixed formulations such as a sustanon, for example, is all available in the market, but under the prescription. However, in many patients, the issue is not that the body cannot produce testosterone. It is that the system is functionally suppressed by chronic stress, poor sleep, inflammation, or overtraining. And in this case, direct replacement is not always necessary. We can support the pathways more gently using DHEA, pregnenolone, and targeted nutraceuticals such as L-carnitine, zinc, boron, along with the vitamin D and magnesium to optimize the endocrine responsiveness. And we also have a peptides-based tool such as a kisspeptin that able to help us and which stimulate LH and help restart endogenous testosterone production. And this approach is particularly useful in functional suppression rather than through deficiency. And also what we can use in our practice, if the patient has, for example, mitochondrial dysfunction, we have to keep in mind that conversion from the cholesterol to pregnenolone happened in the mitochondria. So in our patient with insulin resistance, high level of inflammation, high level of oxidative stress, the problem can lie not on testosterone, but on the mitochondria function. Now, in this case, we have to address it instead of prescribing just blindly hormone replacement therapy. And for long-term strategies, especially in younger men who want to preserve fertility, we can use certain acting agents as clomiphene and clomiphene. And these medications stimulate LH and FSH and allowing the body to increase testosterone production without shutting down the HPG axis. So key point is this: testosterone therapy in longevity medicine is never about simply giving testosterone. It is about understanding the entire hormonal architecture, identify the weak links, and choosing an intervention that support long-term vitality, cognitive function, metabolic health, and biological youth. And just like a growth hormone and testosterone, another hormone plays a central role in longevity in both men and women. I'm talking here about the estrogen. So estrogen is not always bad. We also need it. Its impact is often underestimated, and in clinical practice, we often begin thinking about it too late. So generally, when we see some level of estrogen in men, we try always to suppress it, we try to control it. We know that this is active hormone that's usually linked with a cancer, but we still need it. In the same amount that balance with other hormones, estrogen is coming like a true longevity hormones. Estrogen is commonly associated with a fertility, menstrual cycle, female physiology, but in reality, its role extends far beyond reproduction. Estrogen is one of the most powerful systemic protective hormones in the human body. It has profound effects on the cardiovascular system. Estrogen improves endothelial function, supports nitric oxide production, and helps maintain vascular elasticity. It favorably regulates lipid metabolism by increasing HDL and lowering LDL, reducing the risk of atherosclerosis and cardiovascular disease. And on a structural level, estrogen stimulates collagen synthesis, not only in the skin, but also in blood vessels, joint, connective tissue. And this is one of the reasons it plays such as a crucial role in skin quality, skin health, and overall tissue resilience. And at the cellular level, estrogen activates mitochondrial function and enhances energy production. In the brain, it reduces neuroinflammation, protects neuron from oxidative stress, and supports synaptic plasticity and neurogenesis. And this partly explains why premenopausal women have a lower risk of cognitive decline compared to men of the same age. And estrogen also modulates neurotransmitter system, particularly serotonin, directly influencing mood stability, emotional resilience, and sleep quality. And of course, it is essential for maintaining bone density and preventing accelerated bone loss. So when estrogen levels begin to decline, whether during perimenopause, menopause, or early due to stress, metabolic dysfunction, we start to see very characteristic pattern: hot flashes, sleep disruption, mood instability, cognitive fog, joint pain, dryness of skin and mucosa, and accelerated aging of both skin and vascular system. And it is important to understand that this is not simple a hormonal transition. It is a physiological shift that can significantly accelerate biological age if left unaddressed. And that's why in longevity medicine, we don't view estrogen primarily as a reproductive hormone. We see it as a systemic longevity hormone, essential for brain function, vascular integrity, skeletal strength, and skin quality, and overall biological resilience. And when correction is indicated, we work with a bioidentical estrogen therapy, carefully tailored to laboratory data, the clinical presentation, and always in balance with the progesterone and with proper monitoring of estrogen metabolites to ensure the long-term safety. And again, estrogen is not only about the femininity, it's about cognitive clarity, cardiovascular longevity, tissue elasticity, and preservation of biological youth. And although estrogen is traditionally labeled as female hormone, in reality, it is equally essential for longevity in both men and women. In men, estrogen plays a critical role in cognitive function, bone density, metabolic stability, and even libido. And a balanced conversion of testosterone into estrogen is necessary for normal sexual function, emotional regulation, and overall vitality. And when this conversion is impaired in either direction, men often experience fatigue, mood instability, reduced libido, and increased cardiometabolic risk. And we often see the situation when patients started hormone replacement therapy with a testosterone. And then on the regular checkup, we do the blood test, and there is an extremely high level of the hormone estrogen because they're increasing aromatization. And the one of the main mistakes that usually made in the clinic is the prescribing aromatase directly. And anastrozole or any other medication, it stops fully the conversion from the testosterone to estrogen. And what we see, instead of gaining muscle mass, increase libido and erectile function, men come back to us. Our patient came back to us with the main complaints: erectile dysfunction, problem with the sleep, mood swings, and depression. And this is horrible. So we have to address this condition more smart and more personalized. And sometimes it's better to change the testosterone replacement therapy rather than fully suppress the production of estrogen. But in case if we really need it, the anastrozole prescription should work for a short period of time. Usually we use it for 3 weeks, once per week, and it's more than enough. So in women, estrogen acts as a central regulator of systemic health. Again, it supports the vascular integrity, joint function, skin quality, emotional resilience, brain performance, lipid metabolism, and sleep regulation. And its influence extends far beyond the reproductive system and touches nearly every tissue involved in healthy aging. But what truly matters in longevity medicine is not a single estrogen value, but balance. Both estrogen deficiency and estrogen excess can be detrimental. Low estrogen accelerates tissue aging, worsening cognitive performance, compromises vascular elasticity, and significantly reduces quality of life. But in the same time, excess estrogen, on the other hand, promotes inflammation, metabolic dysfunction, and increased risk associated with the impaired estrogen metabolism and detoxification. And the worst effect that we see is, of course, a cancer risk. And that is why our approach is always individualized. We assess not only hormone levels, but also estrogen metabolites, liver detoxification capacity, genetic pathway. So if a patient has a COMT mutation, it already will be the right sign for us, and the broader hormonal context. And only when we do choose a gentle physiological correction aimed at restoring biochemical harmony rather than forcing levels in one direction. So again, estrogen not about the femininity, it's about tissue integrity, cognitive clarity, vascular youthfulness, and long-term longevity for both men and women. And again, now let's talk about the progesterone, a hormone that is still widely underestimated in longevity medicine. Most people associated progesterone with a fertility or menstrual cycle, but again, in reality, it's role extends far beyond reproduction. Progesterone is one of the key hormones of restoration and internal balance. It is a hormone that allows the body to shift from the constant fight or flight to repair and recover. And one of the progesterone's most important functions is the regulation of the deep sleep. When progesterone levels are optimal, the body enters slow wave sleep more easily and remains this longer. And the main complaint that you will see in the patient with a progesterone deficiency is that they're not able to maintain deep sleep. Their sleep is very superficial and they frequently wake during the night. So, as you know, deep sleep is where true regeneration happens. I mean, tissue repair, lymphatic clearance, mitochondria recovery, nervous system restoration, and progesterone also modulates GABA and serotonin receptor sensitivity. Rather than acting as a sedative that forces relaxation, it enhances the brain's natural calming pathways. And here's again the catch. If you have a proper amount of the neurotransmitters, but the progesterone level is not enough, the neurotransmitters will not be able to link with their receptors because they depend on the progesterone level and receptors sensitive for that. We have receptors insensitivity when the progesterone levels dropped. So moving forward, progesterone have also neurological effects that we already discussed, and its deficiency we often see in our patient with anxiety, inner tension, irritability, or very classic complaints. I fell asleep, but I don't feel rested. This is also very common. And beyond its neurological effect, progesterone is a powerful neuroprotective hormone. It reduces oxidative stress in the brain, supports myelin repair, and has a direct anti-inflammatory effect. And on the immune level, it acts as a gentle regulator. So it's preventing the immune system from shifting into chronic low-grade inflammation, which we know is one of the main drivers of biological aging. Progesterone also plays a crucial role in hormonal balance. It modulates estrogen activity, buffers excessive cortisol responses, and contributes to overall endocrine stability. So when progesterone declines, the entire hormonal network becomes more vulnerable. And in women, this often manifests as a PMS symptoms like fluid retention, breast tenderness, headaches, disrupted sleep, and impaired stress recovery. But in men, progesterone is no less important, although it is a very rare discussed. But progesterone helps regulate the balance between testosterone and DHT, supporting prostate health and hair follicle regulation. So when progesterone dropped, we always see the problem with the hair, like androgenetic alopecia can be there, and enlargement of the prostate. So in other side, progesterone also modulates aromatase activity, helping maintain a healthy balance between testosterone and estrogen, which is essential for metabolic health, cognitive function, and long-term hormonal resilience. And from the longevity perspective, progesterone is true a hormone of harmony. When its levels are optimized, sleep dips, cognitive resilience improved, emotional stability returns, and the entire hormonal network function more smoothly. So when we talk about the hormone of youth, progesterone absolutely deserves a place in that conversation. And it's the quiet architecture of recovery, the hormone that supports not only a longer life, but a calmer, better rested, and more resilient one. And up until now, we have discussed the classic youthful hormones, like a growth hormone and sex hormones. Of course, they're extremely important for maintaining vitality, muscle tone, and reproductive function. However, if we talk about the true hormones of longevity, the picture becomes much more broader. Longevity hormones are those that not only maintain appearance and reproductive function, but also support metabolic, nervous, and immune health. And they are crucial for protecting ourselves from aging and promoting resilience throughout the body. And among these hormones, 3 stand out in particular. First, it's melatonin. Most of us know it as a sleep hormone, but it's also a powerful antioxidant. It protects our DNA and mitochondria, regulates circadian rhythm, and promotes tissue regeneration. And its role goes far beyond helping us to sleep. It's a key defender against cellular aging. Second one is oxytocin, often called the bonding trust hormone. Oxytocin lowers cortisol levels, supports immune function, and positively affects metabolism and mental health. And it is a hormone that helps our body adapt to stress and maintain balance in social and emotional context. And third, we have DHEA, sometimes referred to as a youth marker. So DHEA is a precursor to both androgens and estrogens and plays a vital role in maintaining energy level, immune competence, stress resilience, and vascular health. And its levels reflect biological age, not just chronological age. So these longevity hormones move us beyond the classic endocrine concept of youth. They are directly connected to tissue regeneration, cognitive function, and the body's ability to withstand stress. And we have to understand and support them because it's essential for true anti-aging and optimal long-term health.